for joining us on Across the Fence. I'm Jolie Whitney. Arthritis is the #1 cause of disability in the U.S., and it affects nearly 60 million adults and hundreds of thousands of children, according to the Arthritis Foundation. Over 100 types of arthritis and related conditions damage the joints and often other organs. To talk about arthritis and Vermonters, I'm joined by Suzanne Kelly. She has worked with the Vermont Department of Health and Public Health, Nutrition, and Physical Activity for over 20 years, and currently she manages the Arthritis and Health Community Design programs. Karen Westervelt is also with us. She is the Educational Program Director for the UVM Osher Center of Integrative Health, a clinical associate professor, a fellow of the American Academy of Orthopedic Manual Physical Therapy, and for over 30 years, she has had a career of helping people with musculoskeletal injuries. Thank you both for being here. We've got years of experience at the table. This is great.
Thank you for having us.
And we'll start with you, Suzanne. I just want to start by asking, what's the Vermont Arthritis Program?
Sure. Thanks for having us here. And on my way here, I was thinking this is a great topic to be talking about today because it feels like spring out there, and I think a lot of people are considering getting out and being active, and some of the programs that we'll be talking about today will help people get out and be active, especially if they have arthritis or joint pain. So the Arthritis Program is a program from the Vermont Department of Health. We have funding from the Centers for Disease Control and Prevention, or the CDC, to basically stand up programs to help people become physically active around the state. As you mentioned at the sort of top here, arthritis is a pretty prevalent condition, and in Vermont it's actually the most prevalent chronic condition for Vermont adults. So 40% of Vermonters ages 40 and over have arthritis in the state of Vermont. So this is a really important program, and we're really happy to finally have funding to support those folks.
Absolutely. So somebody not in the know, it kind of feels like arthritis is just a thing that happens as you get older, but it's preventable. Is that right?
Well, it's not really preventable necessarily, but there are things that you can do to delay the onset, like just taking good care of your joints and making sure before you're active that you warm up, that you cool down afterwards, that you try to do things to make sure you don't get injured if possible, and just stay active.
Yeah, it's some great advice and something we can all take into our daily lives. Yeah. I know I should stretch more. So Karen, as a physical therapist, what do you recommend to somebody with arthritis?
One of the most important things for people with arthritis is to keep moving. So as a physical therapist, I like to tell my patients that motion is lotion. So when we do low impact activities such as walking or cycling or cross-country skiing or stretching, it produces motion at our joints, which helps lubricate the joints. And it's that motion that keeps the articular cartilage healthy. So the other recommendation I have for patients and people with arthritis is to keep strong. Mm-hmm. So the stronger your muscles are, the more they reduce the impact forces that go through the joints and protect the joints.
Sure, and we're talking about the Walk with Ease program, and we'll get into that a little bit more later, but is walking a good way to start getting active?
Walking is an excellent way to start getting active. It certainly is.
So are there any physical activities where you're like, oh, easy? Or is it just pretty much any way you're getting outside and moving is good?
For somebody with arthritis, a low impact activity is a really good choice, and there are many to choose from. So walking, cycling, swimming, and the National Arthritis Foundation has programs specifically for walking, like the Walk with Ease program that Suzanne and I are talking about today. There's also an aquatics program through the National Arthritis Foundation that works really well for people with arthritis.
Yeah, some great options there. And Suzanne, you mentioned the goals of the Vermont Arthritis Program, but you also have a fun acronym to share with us. What is it?
Right, so the acronym, we say it as ABBIES, that's how we pronounce it, but it is the Arthritis, oh boy,
Arthritis Appropriate Evidence-Based Interventions. Is that it?
Exactly. Arthritis Appropriate Evidence-Based Interventions.
Great. Good thing we have the acronym for it.
Right. Good thing we just call them ABBIES. So these are basically programs that the CDC has decided through research and evaluation that they actually work for what we want them to work for. So they really help relieve arthritis pain if people participate and do them regularly. There are also programs that we're able to implement in community settings or online.
Sure. What are a couple examples of these?
Oh, yeah. So like Karen was saying, we actually have several that are running in Vermont right now. One is Walk with Ease, the Arthritis Foundation Aquatics Program, the Arthritis Foundation Exercise Program, and also there are some self-management workshops. So the Chronic Disease Self-Management Workshop and Chronic Pain Self-Management Workshop.
So, and when you're talking about these goals, are you trying to reach providers? Are you trying to reach people who have arthritis? Who's the target for this?
Yeah, thanks for asking that. Actually, both of those. So there are two things we're really trying to get done or accomplished with this funding. The first is obviously to help people with arthritis or joint pain. You don't have to have a diagnosis of arthritis to participate. So we really want people in that situation to hear about these interventions and to sign up and participate. At the same time, we want healthcare providers to remember that physical activity is really good for people with arthritis or joint pain, and we want healthcare providers to be referring their patients to the programs.
Absolutely. So you have to do it through a referral, or can you sign up outside of that?
You can really sign up outside of that. We're working with a whole bunch of different agencies around the state, and you can just contact those agencies directly to get involved.
Great, more the merrier. And it sounds like we
Yeah.
have some sign-up information at the end too. So if
Yeah.
you're at home and you're hearing this and you're like, I want to be part of that, we'll help you
Yeah.
out. And the Vermont Department of Health Arthritis Program is kind of new, but you've been working with some partners, is that right?
Right, exactly. So what I didn't mention in terms of the prevalence is that there are certain groups that are more impacted or affected by arthritis than others. So women, older people, people who have lower incomes, people with disabilities for sure. So what we're doing is trying to work with organizations around the state who work with those populations. So we are working with the Area Agencies on Aging, an organization called Support and Services at Home, or SASH, Live Well Vermont, that does wellness programming for state employees and retirees. So a whole bunch of different groups that work with those populations, and each of those is offering different interventions or programs.
Absolutely. And Karen, for this work, it's not just clinical, it's personal. Talk about that.
Oh, yes. As many of the things we get involved with our work, they often go back to some kind of personal story. So I was a gymnast when I was growing up. I started when I was 3, and
Wow.
I competed through a Division I university program, actually at UVM when we had one. So I had a career-ending knee injury when I was competing, and I tore my ACL, which is one of the major stabilizing ligaments in the knee. And that's kind of how I got quite interested in arthritis and helping people with arthritis. ACL injuries are really common injuries among female athletes. And unfortunately, we see that a traumatic injury, like a traumatic knee injury, like an ACL injury, will often lead to early onset osteoarthritis.
And we said at the start of the program, you've had over 30 years as a physical therapist. So what do you see as your role with the Vermont Department of Health's arthritis program?
Well, that's a good question. I think my role as a physical therapist is to promote physical activities, to keep people moving. So as a physical therapist, I've worked with people. I see the benefits of being physically active, but I'm also an educator and a researcher. So I work with students and I work with our future healthcare providers. And I think if we can get the message out to our next generation of healthcare providers that people with arthritis are healthier and do better when they move, then we can help, and that next generation of healthcare providers can really make a difference.
Absolutely.
So,
And in
yes.
your years, we've said you've had 30 years of experience, which is
Yes.
incredible, but have you seen, even from when you were kind of getting talked to about your injury, have you seen a change in how we talk about arthritis?
Absolutely. People used to think that arthritis was a wear and tear thing, that it just, it's wearing out, I probably shouldn't use this joint anymore. And now we know that's not quite true. That we often see that people who do move actually will have less pain, particularly less arthritic pain. So even if somebody has an arthritic joint, getting them moving, doing some of the low impact activities like the Walk With Ease program can be very beneficial at reducing the pain of the arthritis they're having, improving their function, improving their overall health. So
Absolutely. And I think you might have answered this a little bit earlier, but if you're a younger person and you get injured, are you more prone to getting arthritis?
Oh, that's a good question. And unfortunately, the answer is yes. Yes, one of a traumatic lower extremity injury, for example, to the knee, to the ankle, to the hip, is more likely to end up with somebody having early onset osteoarthritis. So a traumatic injury is a risk factor for early onset osteoarthritis.
Sure. So a great encouragement to get back up on the horse.
You got to get strong again.
Yeah, get back at it.
The thing is to get strong after that injury.
Absolutely. And now let's talk
Yeah.
a little bit more about the Walk with Ease program. This is self-directed,
Yeah.
so how does that work?
Yes, so the Walk with Ease program is an evidence-based program designed by the National Arthritis Foundation. And it has been proven to be effective to reduce the pain of arthritis and improve function, whether it's delivered in person, and we have some programs across the state that are doing that, or whether it's delivered in the self-directed format. So that's what we've decided to do with the UVM Walk with Ease program, is we're offering a self-directed program so that we could reach people all across our rural state. And but we wanted to take it one step further. So we've enhanced the program by supplying people with a guidebook that Suzanne helps them get. So it's the National Arthritis Foundation's guidebook. And then we pair our community members with arthritis with a healthcare provider student. And the student will actually get on the phone or get on Zoom and weekly, during the 6-week walking program, connect with that community member to encourage them and bring them through the guidebook and to help them to set goals for hopefully walking 3 times a week at their own pace and their own speed, and teach them some gentle stretches and some gentle strengthening exercises. So when we don't have students, we're also enhancing the program by sending people a weekly email to encourage them and keep them going.
Absolutely. So this is kind of meeting people where they're already at. Is that right?
That's a great way to describe it.
All right, absolutely.
Yeah.
And we're almost out of time, but I quickly want to ask, it sounds like you both have been working in this field for a good while. So do you have any success stories, anything that stands out about seeing somebody really overcome this?
Karen does.
I have a
Before
good
she
story.
jumps in, I do want to mention that all of the programs are free. So I just want people to know that check with your area agency on aging, check our website eventually, but just know that they're free and just for anybody who's interested in participating. Just want to make sure we get
Great
that
to know.
in.
I'm sorry, we're actually out of time now, but no, this is great. That was absolutely wonderful. But thank you so much for joining us today. And we have some information up on the screen now about how Vermont Arthritis Program, or the UVM Walk with Ease Enhanced Self-Directed Program. You can visit the website on your screen for more information on that. That takes care of our show for today. I want to thank the crew behind the scenes here at WCAX. I'm Jolie Whitney. This is Across the Fence. Have a good one.